if we are waiting for the instrument to be approved, then it looks like we may not necessarily hit the day because you have so many staff. The application process to employ takes a reasonable time to acquire a staff into a job. And we running out of time.
Thank you, Honorable Ron. Chair, Transition Committee, you can give a response.
Chair, honorable members, my name is Cap Kilwalk Jason, Chair of the Transition Committee. I'd like to respond as follows. First of all, what the PS has provided, I'm simply providing details under that. In terms of the HR transition, honorable members, the sequence of events are the following. First of all, you seek the categorization of the new body that has been established with your social health authority. And you seek that categorization from S.H.A, the State Advisory Committee, State Corporations Advisory Committee, or S.H.A. So you seek categorization. And I just want you to appreciate also the bureaucratic delays that happen. So once that categorization was received, it was like about a month after requesting, then you develop the HR instruments now suitable for that category.
So you receive categorization. What is the category now?
The category is that it's now categorized as a financial institution, financial state corporation, PC 8A specifically. So we requested and received state categorization.
But it took about 1 month to receive that. After that, then we developed the HR instruments, what they call HR instruments. Basically, the organizational structure and the different positions, the level positions, all of those things. Quite a heavy piece of work, I think more than 100 pages. Those are the HR instruments, because without the HR instruments, you cannot even begin to recruit. So once you finish the HR instruments, then you submit those HR instruments again through the bodies that we report to. One thing that we didn't mention when we talk about the terms of reference with the Transition Committee is that we report to the ministry and the two chairs, the chair of the Social Health Authority and the chair of NHI. Those are the parties to which we report every work that we do. And so the HR instruments were completed in April and they were submitted. Now it goes through a long process before finally we can say now these are agreed. Then what happens next? You request S.H.A to approve those HR instruments. Initially there was an issue about whether it's S.H.A or Public Service Commission, but it was eventually submitted to S.H.A to then approve the HR instruments. Remember, before they are approved, you cannot begin any process. You cannot do any recruitment because those positions have to be approved. And so, as we speak, the HR instruments were submitted by the ministry to S.H.A. S.H.A, there is a tricky issue here because the board of S.H.A, their term is coming to an end next month. And so the CEO of S.H.A was rushing to sort of schedule a meeting of the board
S.H.A to give approval. The last information I had is that it was supposed to happen this week. I hope it does, so that eventually the HR instruments are cleared. Once the HR instruments are now cleared, the next process would be for the Social Health Authority board, guided by the ministry, to begin the process of recruitment. And our recommendation as a TC is that start at the top. From the top, CEO, the top directors, and so on, and keep coming down this way. But you're right that we are likely to run out of time because of the delays that we have suffered to date. Now let me move quickly, Chair, to the assets and liabilities verification exercise. Now that one again We consulted and found that the government body that was competent in working with us, we're a team of 10 officials, 10 professionals. We have benefited from expert input from about 68 experts from across government because we are empowered to co-opt resource persons. But in this particular exercise of asset and liability verification, the competent authority was the Treasury, the National Treasury. So we sought
permission to be given top officials, staff of officers of the National Treasury to constitute the asset and liabilities verification team. It took 2 months to get those officers cleared because they were all very busy because of the budget and all sorts of things. But eventually, we got officers. We got 25 officers from the ministry, from the National Treasury. We got some from the Ministry of Information and ICT, from S.H.A, from housing and the body, the government agency that is responsible for valuing land, valuation of land, because they have some.
That exercise was completed, involved a lot of logistics, from Loitoktok to Wajir to whatever across the country. We delivered. That report was finally given to us last Friday by the National Treasury. And so we are now incorporating it in our final transition committee report, which is very comprehensive. The report from the National Treasury team alone is 120 pages. And so we will put together our comprehensive report and submit it to the 3 parties, the Ministry, the S.H.A board, and the S.H.A board on the 8th of August. We will burn the midnight oil, make sure that report is polished, ready to be submitted. And so, Honorable Chair, it's a comprehensive report. What the PS has highlighted would be sufficient for your purposes because it's a very big, detailed report. And I'd like to
formally submit that before it is shared with the public. Because it will go to the 3 parties that they receive it, and then maybe they have comments, we incorporate their comments, and then finally you will have the final report. Thank you. I submit.
Yes, Honorable.
Chair. Just a follow-up on S.H.A. If I got you correctly, Chair, we do not have an organizational structure for S.H.A as we speak. Has not been approved.
It has not been approved by S.H.A.
The S.H.A is to meet this week.
Yeah, but as we speak today, it doesn't exist.
Doesn't exist.
That's one. 2,
Yeah.
I want to find out, in terms of staff of S.H.A, who is it that is employed by S.H.A at the moment? Do we have people in active capacity or expressly employed by S.H.A? If they are in active capacity, what is stopping S.H.A from recruiting the higher level staff so that we don't have people acting if we are going to take this organization to the next level?
I think that will be responded by the Chair S.H.A.
Yeah.
Chair S.H.A, you will take that, then you will be able to respond. Yes, Honorable Kibageni.
Thank you, Chair. I think first things first, the Transition Authority must first seek extension of their mandate. That should be the first thing, because now they are operating outside what needs to happen. Secondly, Chair, well, I appreciate the excellent description of the system by our esteemed PS. I have a problem. We had asked some time back for details on the procurement and other details around these systems.
We will not go to the system. Let's just finish this, then we go to the system. Just hold your horse. Dr. Nyeka, just hold your horse, we'll go to the system, then we'll ask.
I don't know whether this is for you. You know, when I've had all that, I just ask myself, who is managing the staff who are there now? What is their status?
Chair and S.H.A.
Thank you very much.
And also give assurance about the transparency when it comes to recruitment and transitioning to S.H.A.
Thank you very much. In terms of confirmation as to what, whether we have substantive staff at S.H.A. at the moment, other than the board, which is substantive at the moment, the rest of the people are in an acting capacity. One was forwarded, seconded from the ministry, that's the corporation secretary, and then those who are going to be key in terms of the transition, the directors, we have the CEO and the director ICT, director of finance, and the director of provider and beneficiary management. Those are the ones who are seconded at the moment. However, the NHIF infrastructure in terms of the management and the staff is still in place, and that's how we have been able to continue with our operations seamlessly. Please note that in the absence of those HR instruments being approved, we cannot be able to recruit substantively, so that has to be at the time when that is given, we are given the authority to do so.
When we say our operations, who is our NHIF or S.H.A?
It is S.H.A. at the moment because, as you know, that the law transferred all assets and all liabilities and all rights and all operations are under the operation of S.H.A. So these are being done by the NHIF infrastructure in the interim. But at the moment, at the point when the HR instruments are approved and we could include substantively, those functions will be effectively transferred. And it was done in that manner so that seamless operation continues without disruption.
So should something go wrong, who holds responsibility?
It is the S.H.A. board.
You know the challenge, Chair, is, for example, if you have the CEO who is acting for S.H.A, at the same time is NHIF, at what stage is he NHIF and at what stage is he S.H.A?
As you are aware, the NHIF board doesn't have any operational functions that they're performing at the moment. Their only mandate at the moment during the transition period is winding up activities, and therefore everything to do with operations is under the S.H.A board.
So meaning even the staff who are the regional offices are S.H.A?
Are S.H.A, they are directly responsible, S.H.A is directly responsible for them.
Yes.
Maybe I can just add a clarification, because the questions the honorable members are asking questions that we wrestled with also as a transition committee. Because remember, we have an NHIF here, we have S.H.A, and we are in the middle. We are supposed to verify the assets and liabilities before they are transferred to S.H.A. Now, as my colleague Dr. Loeng has just said, the act that you passed in Parliament said from November 23rd, all assets and liabilities from this particular moment transfer to Social Health Authority. And so staff also are part of the assets of the organization, employees. So what we did as a committee was we said, you have custody of all these assets, liabilities, you, Social Health Authority, you have custody. NHIF's role was limited to
simply winding up activities, and they got that interpretation also from the AG's chambers and AG's office, that your role is simply facilitating the winding down. So the substantive role is with Social Health Authority, but not, so they were having staff in, I don't know what the legal term is, but they were in those positions waiting a proper legal process to confirm their positions. And they could not be confirmed in those positions until we have a new organizational structure, which is totally a different organization now because it's mostly digitally enabled, and then approve that structure and then now recruit and then give them substantive positions. But all NHIF staff right now belong to Social Health Authority across the country.
And Chair,
Tanyekal.
you actually have staff except you are operating in the old structure. Yes. So you have staff, you are operating in the old structure. And that structure is not NHF anymore. It is now a S.H.A structure, even if inherited. So you should now just proceed with operations. And what we are doing will now be actually transferring within yourself. That's shifting within yourself.
Chair or PS?
I totally agree with the honorable member. But as a new organization, it must have its own HR instruments. So that's the reason why we've developed the new HR instruments. So that when you onboard the staff, depending on the staff establishment and the category of that staff, noting that now this is a totally different organization that has been categorized differently. Therefore, it requires for onboarding those staff based on the HR instruments. It's a normal process. Even any other old organization can still submit, can request for approval of a new structure of the staff establishment based on the needs that they are facing currently. So this is not, it's not something special. What we're doing is we are basically at a transition state, coming up with a new structure which will help now Social Health Authority on board the current staff of NHIF based on the criteria that I've set out. The criteria is now all those staff that are in NHIF will apply for those positions because they'll be called different. Maybe claims management, claims and benefit officer will be called a different name as per the new establishment. So those are the ones that will now be advertised. And the staff from NHIF, who are now the staff of Social Health Authority, become given the right of the ones to apply first. So basically, we are saying that it's only the instruments that is required, otherwise the staff, that the way it is now, will look at the new establishment based on the approved establishment and apply accordingly.
So, Chair, the word NHIF and all the word NHIF should just cease to exist. These are S.H.A staff.
It is ceasing to exist on the 22nd of November.
It just ceases to exist.
Yes, legal.
It just ceases to exist.
Yes.
These staff are your staff. All you are doing is restructuring.
Call it that, please.
Honorable Cynthia, then Honorable Martin.
Thank you, Chair. I think I am a little bit more confused than I was previously, because the chair transition said the purpose and the reason why we still have the NHIF personnel and whatnot is for purposes of winding up.
For winding up activities. But now the agreement by the PS in regards to the comment made by Dr. Nikal confirms that it's not winding up, it's continuing. Which one is the correct position, Honorable Chair? The position of the transition chair or the position of the PS agreeing with the suggestion or comment by Dr. Nikal? Because honestly, that's the only thing that makes sense.
Are you asking me or you are asking the PS?
Through the chair.
Okay, the PS. Honorable Martin.
Chair, my problem is how how this translates to the services on the ground. I hear the chair S.H.A saying it's seamless. It's not seamless. Secondly, the legality. It's like a new wine in an old skin. You have a new establishment. You have a new, old staff. How do you transit them, especially the accountability, claims, reimbursements? How do you transit them and hold them accountable should anything go wrong? If they are not officially recognized by the S.H.A,
Yes,
because they are NIF employees, and that, even if that dies legally, but they are still doing the function, how will that now work?
Honorable Songone.
So, Chairman, we're just pressing the same issue. Because I just want clarity. If I were a member, if I were a worker, an employee of the NHIF today, and come the September date, what do I consider myself to be?
November date.
The November date?
November, yes.
November date. What do I consider myself to be? Is it a former employee of NHIF, or a current employee of S.H.A, or somebody waiting to be sacked or to be taken on board? What is the exact position for those people who are working for NHIF now?
Yes.
Chair, let the chair of the S.H.A take over, and then I will also clarify on the issues raised by Honorable Chair, honorable members, I do agree that the position we find ourselves is complex, and it is complex out of necessity purely because of the critical nature of the functions that NHIF performed that are being transferred to S.H.A. It was not possible for us to switch off and switch on, and we need a transition period. That's the what advised aspect of having the transition committee. So with everything else, much as all the assets and liabilities and so on were transferred, in terms of operations, because of the process of requiring to onboard new employees, it became necessary that we have this transitional period. So I do admit it is complex, but I think it is necessary in as far as we cannot afford to disrupt the operations. But maybe also the Corporation Secretary will get a chance to comment, because a lot of the issues here are of legal nature.
Terry, you can make your comments using, as I said, without their comments.
Thank you, Chair. Indeed, the Transition Committee, the S.H.A board, and NHIF were all given the opinion from the Honorable Attorney General. And it was with regards to what happens now that this law has come into place. One of the issues that were raised was the staff of NHIF. So in terms of the staff of NHIF, the AG had guided that all rights, obligations, and powers and duties that were being performed under the NHIF, which includes now the obligations to that are attendant to the NHIF staff, were vested with the S.H.A board. So that has been transferred to the S.H.A board. Unfortunately, or what Chair is saying is that we are now in a very precarious situation in terms of the law again did not transition all the staff from NHIF to S.H.A. So the transitional provisions provides that the staff of the NHIF, the staff of the S.H.A shall recruit its own staff, but shall give priority to the staff of NHIF in its recruitment once it gets the approved staff establishment. And the staff of the NHIF, if they are not recruited, will retire from the public service or be redeployed within the public service. So that is the issue that the legal issue that is there, is that while the obligations have been vested with the S.H.A board, and obligations include paying the staff disciplinary issues within the staff have been vested with the S.H.A board. The staff need to reapply to the positions under the S.H.A establishment, and that is why I think we are insisting that until the HR instruments have been approved, the S.H.A structure is very clear. Then now the staff of the fund will be given priority to apply under S.H.A.
Let me just ask a simple question. Are you transitioning or restructuring? And this committee, is it really a transitions committee or a restructuring committee?
The committee legally is a transition committee.
And functionally?
Let me just add to what the State Councillor said, and what responding to the questions from Honorable Cynthia, is that the law gave the functions to the S.H.A board to manage the NHIF structure as it is, remaining with its own structure without touching it. Human resource, for example, we still use the NHIF human resource instruments. S.H.A, once their staff, HR instruments have been approved, will then now transition those staff and manage them under the human resource instruments that have been approved for S.H.A. So it's, as said, it's just a very, we are waiting for the approvals and then the commencement of the onboarding of the NHIF staff to Social Health Authority staff. Without
without the HR instruments, then they cannot vote. What remains, they will still maintain their staff of NHIF using the human resource establishment or structures that were approved for NHIF.
You know, in a layman's, without going into very much legal, S.H.A is using the staff of NHIF to run its activities. Yeah, I think that is the in a simpler way than. But now, once you have your instruments, then you will now recruit the staff for S.H.A. I think so that we make progress. I want us to move into the ICT. What do you want?
Chair, given what has been said by the chair of the transition committee, the legal, and even the responses from the chair and the PS, I want to ask an honest question. Do we believe that we will be able to meet all this by 1st of October? Or it's high time we start this discussion early, have an extension, and have a realistic date for launching S.H.A?
Okay. My response to the honorable member is yes. Once the HR instruments are approved, as you have highlighted, we are ready. We have put all mechanisms in place to meet the 31st deadline of October.
Honorable Cynthia.
Yeah, so, PS, are you in essence telling us that you are able to pull up the 464,000 already onboarded or registered members to S.H.A to the expected number that NHIF is now handling? Because if we are looking at that date to be able to operationalize S.H.A and say that every time you go to the hospital, you're going to receive your services through S.H.A and no longer NHIF, are you telling us you're able to pull that?
Yes.
Yes, we'll be able to pull that. Number one, most of the NHIF staff currently are the ones who are salaried, they are in the informal sector. And we have given notice to the employers that come the 31st of October. All the services rendered under NHIF and members' contribution will now be based on 2.75%, which then will go to S.H.A. And they will be entitled to the S.H.A tariffs and benefits and not the NHIF package of benefits. So that is the difference.
Let's go to the ICT, which Honorable Kipagende I think is banning. And in it we had asked to that status of the ICT system upgrade with regard to the protection of users and service providers data during the transition. And if there is progress made, provide the tender process, our details, including contracts signed with the service providers, if any, for managing universal health care. Honorable Kipagende, you can chip in.
Thank you, Chair. I believe the question I wanted to ask, you have literally asked it for me, but I wanted to say the description is impressive, but we need to understand the details. And beyond that, because Chairman, I'm stepping out, I feel like the urgency with which we passed these laws, and again, the urgency with which we want to have them implemented, we will not meet any of these targets. I believe it is necessary that, and I pray that while the President is reorganizing government, the PSS in the Ministry of Health remain, so that we don't have to go back and forth. On a PS, it is prudent that you ask for 1 year. 1 year for you to organize this thing, for it to be firm. These targets we are giving ourselves 3 months, 2 months, we are not going to succeed. We will not succeed. Thank you.
Yes, PS, you can give a response.
Thank you, Honorable Kipagende. Indeed, we intended to implement the laws the way we had processed, and we want to thank the committee because you supported us in passing these laws. However, as mentioned, we have faced challenges. One of the biggest challenges are court cases that we faced. The High Court suspended these laws immediately, they were passed, and therefore we had to wait for a period of time until when we have our appeal went through and the suspension was lifted. and was lifted, I think, in the month of was it January, and then finally now the court gave a ruling on that on the month of July. So you can see the delay that has been caused not out of the making of the ministry or the S.H.A, but because of the court cases. However, as enumerated, based on our plans that we put in place, we are ready to roll out this because it's only dependent on a few. Number one, approval of the benefit and tariffs package, which has been approved. Number two, completion of the system, procurement of the system, which is now the advanced stage. And as you're aware, we are currently running a structure which is already existing. The NHIF staff who are there, who will be part of the social health authority staff. So our transition is going to be smooth in the sense that we are not going to move out of the ecosystem that we already have. And that's why we are confident that this time round, without challenges of the courts, we'll be able to transition the staff and we'll be based on the HR instruments, and once the system is put in place, we'll be able now to start receiving the payments under the social health authority, that is 2.75% as opposed to the previous. So it's basically configuring the systems, changing the new system so that it's able to accept payments and also pay or the claims based on the new tariffs or new packages that we have. Chair, we are confident that this is possible if we do not have any other issue that will stop us from the 31st of October. As I mentioned, everything has been put in place, which have been implemented in my report to this committee. I submit, Chair.
Sorry, Chair.
Yes, Honorable Gibageni.
This system you are talking about, I said it is shrouded in secrecy. You are saying you are at an advanced stage of procuring it, and it's already working. How are you registering members? Where are the adverts for the tender? What is the cost of this system? These are the questions we've been asking. And I'm sorry, Bwana PS, you continually are ambiguous around this particular matter. Kindly be clear. When was the advert done? Who has been given this tender? What is the cost of this? You're saying you're in the process of procuring. How are we registering members already in a system that is under procurement process?
Maybe I could needed to clarify. The S.H.A registration, if you look at it, it is the S.H.A portal. So we are using the current systems of S.H.A to register members.
Current systems of NHI or S.H.A?
S.H.A. We created a new portal under S.H.A.
It's not different from NHIF portal.
Okay.
It is the S.H.A portal.
But whose software?
That's a software that currently that's operated by S.H.A.
That's what we're asking. How is it procured? Or are you using the
new, it's just a portal of this. I may give the CEO to respond on the creation of the portal, how the portal was created.
We have an ICT director whom we requested to come. Can you take the seat here and respond to that?
Acting ICT director.
Is the director MOH ICT? Because
director MOH ICT.
Yes.
Okay. Do we have a director from S.H.A? ICT? Yes, we want you, not him. You introduce yourself and then give the response. Put your mic on.
Honorable members and Chair, my name is Martin Ayo. I'm the Director ICT NHIF. So the
the registration portal was developed in-house through the Ministry of Health. It was developed through an open source platform where the system was configured in-house to allow for registration. So once this has been, once the registration is done, now it's supposed to integrate with the main system that is currently on advanced stage of procurement. So it is more of a web-based platform that was developed to allow for registration.
So, okay.
Yes.
Honorable Martin.
Chair, does it mean that we are having two systems running parallel here? One in-house and another one, the major one, which was existing?
The major one they said is being procured at an advanced stage of procurement.
I tend to think the major one was the S.H.A.
It's the S.H.A system one. So what this system entails, it's going to be in modules. So the registration module, registration portal is a module that will, once the main system has been developed, it will just integrate, plug in, so that now that data will move across the other systems.
Chair, let me ask this question. Is it interfacing now with the current system?
Let me help the officer by just referring back to my response, which I said that the Ministry of Health commenced the procurement of a digital health superhighway that is designed to automate the entire health ecosystem from registration, healthcare empanelment, healthcare service provision, up to drugs logistics. And that's what the officer is saying. So the system that we're procuring is just a digital superhighway that will provide for integration of all those other systems that will be in place within the healthcare ecosystem.
Okay. Honorable Kibagende, I can see you are nodding your head.
That is excellent.
Okay.
What we are saying is, what I'm asking is this procurement of this integrated system, who is the provider? When was it issued? Where is the tender document? What is the cost? And this we've asked so many times. Can we get these details today?
Yes.
Thank you, Chair. I'll wish to, right now, I'll give you the request. We shall submit the tender documents that were submitted. We have not concluded the process. We basically at the stage of negotiations on the contract. Once that is done, then we'll figure the amount will be known based on the negotiated contract. So we have the original tender documents that were issued, which, Chair, I want to request that we'll submit to this committee for your review.
So you will submit the advertisement for the tender, and together with the tender copies of tender documents by when?
Today, next, once we are done with the committee hearings, okay, we will submit that.
All right. What else do you want, Honorable Kibagende, to be submitted? Are those adequate?
Those are adequate.
Okay, Honorable Nikal.
Well, you may have to educate me a little bit on this. Well, what are we buying? Are we buying the hardware, the software, and then we manage it ourselves, or we are buying the service?
I think we'll look at it from the tender document that will be.
Because that is really, really key. Then,
but
okay,
you can still respond, yes. But we'll look at it also from the tender document.
Let me also ask another question because we went together. I've seen that this system will also do claims management. In the law, there was a very important issue about claims being outsourced. If it's outsourced, may. And may still allows me to say if. So if, yeah, if it is outsourced, will it still use this system? Will whoever it is outsourced still use this system?
ICT director?
I'll give to both the ICT director from the ministry and the ICT director from the NHIF to respond to those technical questions. But on the issue of claims, we say May, so we have not reached that stage of.
But Chair, why? If you are planning and buying a system, and within your provision, there is the word may, you must, in good management, I believe, make provision that should I use that may, this system will be. Because suppose you don't, and then you use may, then it means now you have to bring in a completely new thing. So that's why that must be taken into consideration now.
I'll give my technical officers to respond to some of those issues. Chair.
Yes, go ahead.
Thank you, Honorable Chair and Honorable Members. I would like to make a clarification on two things. First is the system that we buy. So we're buying an ecosystem called Digital Health Superhighway. It has 5 key components. One is it has the infrastructure. This is any area we have connectivity challenges, any areas we're doing local area networks, any area we need to divide devices. The second is it has what is called the HAD, which is Health Information Exchange. This is the single point of identification for every client that will be within the healthcare ecosystem. The fourth part is the claim part, which is the e-claim part, which is really to process of claims within the social health authority. The fifth one is also on the logistics, which is to manage all our logistic ecosystem within the healthcare. Now, on the claim part, I wanted to make a clarification also that we have point of services. Point of services can be where you're having the hospital management systems, where you're having any other registration modules that you really face the client. But they all read from the back end from an ecosystem that is reading from logistics to provision of services, to provisions of drug, to identification. Now, in terms of claim, yes, it is very indicated that we will procure a system that will do automation of claim. And what is envisioned is this system will automate most of the claim. Now, there might be some specific scenarios or specific areas where the claims will also need to be rechecked or relooked at by an expert, and that is where the may will come in. And within that ecosystem, there is a part for automation of claim, and there is a part for areas where we may outsource the claims. But we envision that most of the claims, not all, but most of the claims will be automated.
No, I'm not in that area, but I'll still tell you. All those things you have said, you can actually get somebody else doing them on your behalf. Or you can actually get the hardware, all those things. When you answer, you are talking a lot about function. I agree. But there will be hardware stuff that is there, then you have the systems, then you have the staff that is running them. So for me, when I'm buying, I want to know what I'm buying. Compare this with mess. All those things were being done, but the equipment didn't belong to us, and you are paid. So you really must have a clear distinction. Sometimes not knowing everything is good.
Yes,
I'm not satisfied.
Honorable Mary Maingi, you also are not satisfied.
Thank you, Chair. No, we are not satisfied, but I would like to know whether this system has the payment details of members. And I'm talking about the invoicing bit. You may not invoice, but you may want to alert the customers when their payments are due for payment and stuff like that, and how much it is. Does this system have that part of the plan?
Or the ICT director, Honorable.
Mine was a different question.
Then you can hold on. ICT director, you can respond now.
Thank you so much, Honorable Chair, members. Yes, it has the claims, but even more importantly, it has the patient portal. Actually, all
your transaction or your data of healthcare, you will be managing from your phone. So it also has your patient portal where you see all the transactions, you see everything that is being done within the ecosystem as a Kenyan.
Yes, Honorable Ron, you have a different question?
Yeah, I have a different question. My question is about the primary healthcare fund. You must have an estimate or a budget for primary healthcare fund. And my understanding is that that fund needs to come from Treasury. It's supposed to be an allocation. We are talking about kicking off on 1st of October. What is the budget for this fund, and do we have the money?
During the budget preparation of the Boron, we had agreed that we'll have a retreat with the S.H.A to discuss on the budget for the S.H.A, both primary health care, emergency care, and how much it requires for us to provide those services. I think CEO, you can make a comment on that.
Thank you, Chair. Honorable members, indeed, during the budget making process, we discussed this and we said it is very important that S.H.A is well funded for success, and we shall liaise in the office of the plan to make sure that we have a date as early as possible so we can discuss this important budgetary issues. We have been allocated so far 4 billion for primary health care fund, but to effectively run primary health care across the country, across the year, Honorable Chair and Honorable members, we need 61.1 billion. Honorable Chair, Honorable members, we have been allocated 2 billion, but
Chair, with that response, my concern remains that we are hoping to start S.H.A on 1st of October. We don't have any other budgeting process to raise the 61 and 40-something thousand. In other words, we will only be looking at launching social health insurance fund, which is contributory. Is that the position? The other thing that I wanted to raise, is there a possibility of starting these two other funds piecemeal in terms of piloting per county? It's an option. Just a question.
I think let's have that as a discussion, Honorable Oron. I've already ruled on it, so let's have that as a discussion. Then we can be able to look at what are the possibilities of us. The date is from 31st October, not 1st October. 31st October, when the social health insurance will be rolled around. Huh? It's fast, not 31st, no. 1st of October. Okay. So we should be able to have a meeting very soon. Your closing remarks,
Chair,
yes.
Chair, before you close,
yes.
Can I just get clarification from ICT? Because
yes.
ICT is very integral in access to care and all this we are talking about.
Yes.
But I'm not clear because right now we are having NHIF system, right? Yes. Now we are going to have a new system. And I asked before, in your transition, how are these going to interface so that no data is left out? Especially if this is a super one, the eco super one, which have infrastructure claims and all this. And you still say that most of the claims will be done by it, meaning some claims will be had by the state. How is this going to work?
Yes, ICT Director.
Maybe before the ICT Director goes, I'll give to the acting CEO to give, then be supported by the technical ICT Director.
Okay.
And thank you, Honorable Chair and Honorable Members. How we envision to ensure both systems are running. The Data Protection Act requires that data is held for 7 years So the data in the HIF system will have to remain in a format that it can be accessed and used as evidence for 7 years from when it was created. That being the case, the NHIF system will remain. Number two, there is very high likelihood that the claims incurred on 30th of September will not be paid by the 1st of October. And therefore, that system will remain to process all claims as we install the S.H.A system and commence new business using the new S.H.A system. Chair, I submit.
Chair, before we close.
Before we close, okay.
Chair, there's something I would probably, in my mind, thinking. I think from that date, we should stop using the word NHIF and using NHIF system. Use full system. It will still be, it is S.H.A system. So because if you use the word NHIF, you seem to think you are shirking some responsibility. There's no responsibility. Just say the old system. Somebody who wants history will find out where the old system came from. That is point number one. Number two, ask this question and it sounds simple. What are you launching on that day? I was so simply sharp. But remember, in the mind of the people, let's say you call the president to launch it on Monday. Kenyans are expecting that on Tuesday there is something they find if they go into hospitals that they were not getting yesterday. So that thing must be clear. And to me, I'm not very clear what it is. But work out so that if the president or whoever, the minister, launches it, Kenyans who go, if they do it on Monday, Kenyans who go on Tuesday can say, hii sasa ni mzuri sana. They shouldn't just find the same thing they were doing. And lastly, when you were doing about empanelment, I saw something like from the Medical Council and also NACADA. What is the role of NACADA in empanelment? In empanelment?
Yes, yes.
I'll give the chair first and then I'll respond to the other questions.
Yeah.
Very much, Honorable Chair, Honorable Unical, for your question. What we are launching on the 1st of October is the S.H.A benefits package. So what we envision is that on that date, people will be able to access the new benefits that we have promised Kenyans, and that's going to be enhanced over and above what the NHIF benefits package was. So at that point, we are getting a new contribution structure, and we have a new benefits package launched on that day. So that's what we envision. So anybody who goes to hospital should be able to access the benefits they had before on the NHIF benefits package and more. So that is what we are promising Kenyans.
With an aha.
On October.
Aha. It's false. Now this is me. Okay.
Go ahead. Yes.
I think the CEO has really answered what I wanted to say. Basically, that's what you'll be seeing. Just to highlight.
Okay.
For example, under the NHIF, previous current NHIF, the way we're operating it, if you're going for radiotherapy, NHIF used to give like 5 or 7 sessions. But now we're saying once you've been diagnosed and the doctor's prescribed that you're entitled or you're supposed to go through 15 sessions. The 15 sessions will be covered until it is concluded by the doctor that you have covered the 15 sessions. So that limitation will not be there. It is subject to what the doctor has prescribed. And that's what you call the benefit package, which will go through the national validation. And people will be able to see kind of difference.
So if I had saved because I knew I was only to get 7, that day I will be, let me entertain myself. That day I will say, aha, now I'm going to save all this money.
Yes.
Okay, it's okay. Nakada.
Nakada, yes. Chair, I wanted to say on Nakada, just we made the provision in the law clear that it shall be the competent authority. KPDCU are the competent authority, KPDC, sorry, are the competent authority who licenses the facilities health providers. So it is them who gives the list to social health authority to empanel. So there will be no more, it's before. NHIF inspectors used to go to the facilities which have been licensed by KBDC and then go and do another inspection. We are saying it is now the competent authority to give the license and to give a report of what services they offer in that facility. Now, when it comes to NACADA, we have also incorporated a new package, the rehabilitation, okay, where people go for, say, the drug and abuse. So those centers that have been licensed by NACADA to provide such services, then they are the ones, the competent authority, to give the list and describe what services they are offering for the purpose of internal. I submit, Chair.
Just as you, in your closing remarks, I would want you to give us what preparations, especially on sensitization, that you are doing towards the 1st October S.H.A benefits package launch. What sensitization activities you are doing?
Thank you. As I give my concluding remarks, Chair, I want to appreciate again your committee and the tracking that you've been doing in regard to the laws which you supported us in passing and how we're implementing these laws. Chair, I want to say that indeed we've made all preparations, and at the stage that we are in now is basically a rollout. And this rollout, Chair, requires that we consider sensitizing the members of the public on the benefits that will accrue to them once they are registered as their members. So we are doing sensitization for membership registration. We're also doing sensitization in terms of the benefit package that the members will be entitled. So that's why we are going to call for national validation of the tariffs and the benefit package so that all the citizens and members of the Social Health Authority will be entitled and they'll know what are their benefits in terms of this new system. So that is the sensitization part that we are going through.
And I've asked what are these sensitization activities that you are doing?
It is basically educating the members of the public through the radio, various different media stations. We'll also be visiting. We have started teaching training the community health promoters to be able to bring on board the households, notify the households of the new benefits that are entitled once they are registered members of S.H.A. So it's a whole ecosystem of just public participation or sensitization, as we may call it at this stage, for the full rollout. Chair, you remember, I think part of the discussion that we wanted is also to prepare the members of Parliament and specifically this committee so that they also become part of the team that will be supporting us in terms of sensitizing the members of the public the benefits of this package. So we are preparing a whole program that will entail bringing other stakeholders to support the public sensitization, and we believe the members of Parliament are key to this, because as you go to your constituency, you are always faced with challenges of medical expenses that have been incurred by the public because of sickness and they cannot afford. So we want you to be in the forefront, because we all agreed as we are passing these laws that it is going to solve one of our biggest problems of out-of-pocket expenses that we incur differently when providing or supporting our communities. Chair, that is part of the sensation that you're talking about, and you will be seeing this coming out very clearly, because once you put everything, all the systems in place, it will be all systems go. We've just started with the registration. That's why we've said we've been telling people to register, but the other benefits now will come following our plan that we have in terms of rollout. I submit, Chair.
Thank you, Piers. I'll go back to issues about sensitization, because one of the biggest challenges is facing the courts, where we end up with people going to court to litigate that there was failure of this, and among them is issues about sensitization. For us, from where I sit as the chair of health, sensitization is actually supposed to be carried out by the ministry. For us, we do